Okay, so our PICO question is, do mechanically ventilated patients on a PEEP of greater than 10 suffer greater diffuse alveolar damage, or DAD, as compared to patients who are on PEEP of less than 10? The population is mechanically ventilated patients. Risk factor is going to be PEEP greater than 10, while the comparison group will be PEEP less than 10. And of course, the outcome is permanent damage to the lungs. So we chose a particular study called Predictors of Diffuse Alveolar Damage in Patients with Acute Respiratory Distress Syndrome by Phil et al. In 2017. This was a retrospective study analysis consisting of 356 patients. Data was gathered with permission from families between 1991 and 2010 from a database at a university hospital in Spain. These databases, or these autopsies, were reviewed to assess if there was any correlation between high PEEP pressures and diffuse alveolar damage. And 54% of patients who were on PEEP greater than 10 also had diffuse alveolar damage. So this study looked at two different groups of patients that had died during this time period, 1991 through 1999. A higher PEEP was used, and the study found that 56% of those patients who died on a higher PEEP also had DAD, and they compared this with the group from the second decade, 2000 to 2010, in which lower PEEP was being used, less than 10, and only 44% of the patients who had died were found to have diffuse alveolar damage. And the p-value for this group of data was less than 0.5, making it statistically significant. So we know that the findings are statistically significant, but are they clinically significant? And the answer is no. And one of the main reasons is the patients were already very ill and had passed away with ARDS, and therefore there couldn't be any experimental studies to determine whether that would change the course of their care. And also, ventilators became more advanced between 1991 and 2010, and therefore that can be attributed to the less alveolar damage due to simply the ventilators becoming more efficient. And also, it was just a small study. It was done in one center in Spain, and it would be difficult to scale this to the entire world or the entire medical community enough to warrant specific interventions to decrease diffuse alveolar damage with PEEP. And lastly, since this is a retrospective study, the article actually doesn't give any interventions that would significantly change or decrease the amount of diffuse alveolar damage in mechanically ventilated patients, and even goes on to say that further investigation is needed. Okay, so patient and family considerations. If I were asked about high PEEP versus low PEEP in a clinical setting, I would tell the patient or family that optimal PEEP really depends on many factors such as lung compliance, cardiac output, blood pressure, mixed venous oxygenation, things like that. In general, though, the more oxygen the patient needs, the higher the PEEP will need to be. And next, I would educate the patient that although higher PEEP can be dangerous, it may be needed in short duration as the patient needs to be more oxygenated. I would tell them that there are several limitations to this particular study, including that the patients were severely ill and they were all in a single hospital over a long period of time, where the efficiency and safety of ventilators likely increased over that long period of time, and that there was likely some error in an analysis of the chest x-rays, meaning that some of the patients may have been misdiagnosed as having diffuse alveolar damage or not. And finally, the take-home point would be overall lower PEEP has been shown to decrease mortality and has a protective effect in patients who need to be ventilated.